So Charmaine is a retired Canadian physician who developed an inflammatory autoimmune arthritis, like RA, in 2015. After diagnosis, Charmaine researched functional medicine, which strives to understand the underlying causes of the autoimmune condition and to learn what she might do to help along with taking prescribed medications. Charmaine now facilitates Dragon Talks, an online support and education group for people with autoimmune immunity. They have members from Australia, the USA, and Canada, and you're welcome to join them on Wednesday mornings at 10 a.m., which is American Eastern Standard Time, I think, and on Monday evenings at 7 p.m. So today, Charmaine will review pillars of self-care. We will explore why they are each important and to do a self-assessment exercise. This will help us focus our energies on where it is we need it the most. And it gives me great pleasure to welcome Charmaine as our guest speaker today. So I will just stop presenting and give you the floor, Charmaine.
And I'll try to get presenting, but thank you very much, Louise. It's wonderful to be here. Thank you for the invitation, and congratulations on all the involvement over June. That is very impressive. Well done.
Thank you.
Yeah, we haven't quite got stepped up to that level, but we hear from Amanda and we're taking lessons. So everyone has a piece of paper and a pen or pencil. Yeah. Okay, here we go. I'm going to try this. We use Zoom, so I'm not familiar with this program, and we'll just hope I can get it working again.
I have complete faith in you, Charmaine. Don't worry.
Yeah, well, it's not me. It's the program. See, we had it before, and it's
there it is.
All right. Now I want to do full screen.
Perfect.
All right. Everyone can see that. That's excellent. Now I can't see any of you, so don't be shy. If you have a question, just jump in because I can't see you. I won't see your hand. Maybe if Louise can see you wanting to ask a question, she can jump in as well.
Absolutely.
Okay, that's great. And I might actually ask for volunteers to read. You'll see as we go along, because it can just get a bit monotonous if it's always me talking. So I wanted to share with you the pillars that Dragon Talks. The parent group, by the way, is Dragon Claw, which is an Australian charity. And you might wonder what I'm doing. I'm in Canada. What am I doing with this Australian charity? Well, actually, I can't remember how I discovered it, but I was researching like mad when I was first diagnosed. You've probably done that too. And stumbled upon one sentence somewhere and then followed up. So now I facilitate and I'm on the board of directors. We meet every week, and it's my job to find the educators. Anyway, so I thought we'd do an overview of the pillars and a tool for self-reflection. And we actually review this every January, just as a reset button and help us focus our attention where we personally need to focus it. Dragon Claw, which is our parent group, our purpose is to help all autoimmune disease sufferers and their carers or loved ones improve the quality of their lives through a better understanding of how to manage their condition. And the pillars are lifestyle choices that we can participate in ourselves, as well as taking the medication that is prescribed to us. So things we can do. And actually, these are pillars that everybody should be paying attention to, even if they don't have a chronic disease diagnosis. But it is especially important for those of us with autoimmune conditions or other chronic conditions to be actively involved because our condition fluctuates. We're predisposed to complications, some from the inflammation itself and some from medications we take. And we're at risk of developing other autoimmune conditions unless the underlying causes are identified or controlled. And you may know people with more than one diagnosis. Like in our group, we have people with RA, and then they have Sjogren's disease, Raynaud's disease. Some people have inflammatory bowel as well. So the pillars of self-care have been chosen to identify mechanisms that we can take actions on to support our health. They're all interrelated, and actually working on one will help us with another, as you'll see. So I thought the aim of this session would be to raise awareness of these pillars and help understand where, do a self-assessment so we can identify for ourselves where we are and where we'd like to focus our energies. Now, I understand, and Louise, is this right? You finish in an hour, 9:30? Not 9:30 for you, but
Yeah, we've got
what
just
time would
over
it be for you?
we've got just
Over
over
half
another
an hour.
hour. Over an hour we've got left.
Oh, we have over an hour? Okay,
Yeah,
great.
yeah.
That works. Okay. All right, so we've got our paper, pen, and here we go. So if at the top of your page you could write 6 columns, such as you see on the screen, landscape will give you more space. So the first thing is you might want disease monitoring and medicine adherence. The second is nutrition, then sleep, then movement, and then mind and body. I'll just give you a moment to set that up. We all set?
Yes, we've got lots of thumbs up.
Okay, thanks. So I'm going to go through the columns. So the first is disease monitoring and medicine adherence. Developing a monitoring plan that meets your specific needs and goals. And this is likely developed in conjunction with healthcare professionals, but may involve self-monitoring. This will help support you to monitor and stay informed about your health and manage symptoms more effectively and ultimately live a better quality of life. This may include having a suitable team of healthcare clinicians, and often it is a team, not just one person. And by team, I mean like physiotherapy, occupational therapy, nurse, primary physician. And setting up a plan for your checkups and your lab tests and imaging studies. And the first tool that Dragon Claw developed for patients is called Know Your Numbers. And that's available on our website for free. You can download it. And it's a list of the usual lab tests and monitoring things that most people should be undertaking. And they include the blood work, but also include tests like your blood pressure, any x-rays that you should have, skin exams, especially for those living in Australia, tests like that. And it's a way of helping us as patients keep track of where we're at. For example, a lot of our members didn't realize that they should be having regular eye exams, especially if they're on certain medications. And this may also include self-monitoring at home through symptom diaries, summaries of your appointments and test results, and watching for trends in your test results. And medication adherence is working with your professional to develop a treatment plan that you feel comfortable with, and hopefully you've had the experience and time to do shared decision making with your main clinician so they understand what's important to you and help you make choices that you can stick with. So there are benefits to disease monitoring, and that's a fast ID of changes and prompt treatment, better disease control, making informed decisions, improved communication with your healthcare provider, and peace of mind. And number 4 is especially important because if you're keeping any kind of record or diary, then when you see a healthcare provider, you can quickly summarize where you're at or what's been happening. You don't draw a blank. And benefits of medication adherence are kind of self-explanatory. Improved symptom management, reduced risk of complications, such as joint damage or organ failure, better overall health and quality of life, reduced hospitalizations by helping to prevent flare-ups, and improve disease control. So that's the first pillar. Are there any questions about that one before we carry on?
No, all good.
All good. Okay. Are there any volunteers for reading nutrition?
I'm not seeing any hands, Charmaine. I'm sorry.
I was about to nominate you, Louise.
Don't.
I could read.
Okay. Thank you.
Oh, there you
Lucy.
go.
Yep.
Okay, so nutrition is fundamental to our overall health as it provides the body with its building blocks for its structure and function. Nutrition can support inflammation management or create inflammation. It can affect our gut health, which is closely related to our immune health, and much more. Working on nutrition may include changes made individually or working with a nutrition health professional, such as switching to more whole foods diet and removing processed foods, improving the quality and diversity of foods that you eat, creating and implementing strategies for meal planning and meal preparation, focusing strategies to support your digestion of food, focusing on strategies to support your blood sugar, and protocols to improve your gut microbiome or overall nutrition using testing such as stool or microbiome tests, food sensitivity tests, hair tissue mineral analysis, and others.
Thank you. And I think one of the main points there is realizing that our immune systems lie right behind the single lining of our guts. So what you eat and how you eat is extremely important. And if you have what's known as leaky gut or highly permeable gut, which is actually one of the current theories of autoimmunity, proteins can leak through the gut wall and the immune system is sitting right there and responds appropriately by thinking, this is a foreign body, I'm going to make antibodies to it. And then depending on what the protein is like, those antibodies react with our own tissues. And in my case, they reacted to the synovial lining of my joints. And I have an inflammatory arthritis. And when I was first diagnosed, I did some functional medicine tests. I did have a highly permeable gut, and I did have a whole lot of antibodies to various foods. So I worked away on that, and retesting showed a completely different picture. So the benefits of improving nutrition can be reduced inflammation. It might not be a cure, but any reduction in inflammation is important. Improved digestion and gut health, better immune function, better symptom management, reduced risk of nutrient deficiencies, improved energy and mood, and better sleep. There's one of the links between pillars, between nutrition and sleep. Any questions about nutrition? It's one of the mainstays of our education, actually. And there are approximately 6 videos on dragonclaw.net website by our functional nutritionist member, who herself has ankylosing spondylitis. But they're fabulous videos, and they're all there free of charge. You can visit, you don't have to be a member, you don't have to pay anything, and you can listen and learn. Okay, on to sleep. Now, sleep, in North America anyway, and I suspect in parts of Australia this is true, it's almost a badge of honor to say you can get by on little sleep and perform huge amounts of work. But they've shown now how important getting adequate sleep is, and that includes quality of sleep as well as quantity of sleep. And it's especially important when you have chronic illness. Sleep is often compromised because of pressures of work, deadlines, feeling things are urgent, socializing, watching TV, binging on Netflix, and much more. But improving sleep can involve developing healthy sleep habits or sleep hygiene. You probably know some of these. Reducing blue light exposure at nighttime. So that's no screens or wearing special glasses to reduce the blue light. Having a consistent bedtime. Having a consistent time to go to bed and get out of bed. And exposure to natural light first thing in the morning, if at all possible. Improving your sleep environment, often a cooler room and a dark room. And exercise, nutrition, and stress management all can have an impact on our sleep habits and our sleep. And it's interesting, I use an Apple Watch. Lots of people have wearable technical things now, like Fitbits or Apple Watches, and you can monitor your sleep and your deep sleep and how restful the sleep is. And sadly, I've learned that if I have more than half a glass of wine in the evening, my deep sleep is very much compromised. So, sad finding. Benefits of improving our sleep: improved immune function, reduced inflammation, better pain management if you're living with chronic pain, improved mood and cognitive function or ability to think and problem solve, feeling happier actually, better overall health, and lower risk of developing other chronic illnesses. And they've actually shown that sleep is related to obesity and diabetes. Lack of sleep is directly related. Any questions on sleep or comments?
Yeah, I think Janelle has a question.
Okay.
Yeah, I have a quick question, thanks, Charmaine. Can you just tell me what's the difference in the sleep, the REM and the deep sleep? Which is the better one for your health?
They're both important. They're both important. REM sleep is rapid eye movement sleep, and often when you're dreaming. But deep sleep, they feel, is the sleep where your immune system is regenerating and cleaning up and getting organized, if you will, putting all the papers on your desk away kind of work.
Okay.
Yeah,
No,
they're both important. Yeah.
no worries. So just my deep sleep's about 30 minutes.
Well,
So I always wonder what's the better.
it's interesting. Mine on a good night is 2.5 hours.
Oh gosh, that's pretty good.
It
I'll
is.
swap you.
Yeah, but that's if I'm exercising too. There's a big link between, and I don't mean like, working out in a gym exercising, but just they've shown that movement is probably more important than exercise. And they're now saying that sitting for long periods is the next smoking. It's as bad for us as smoking.
Sounds about right.
Yeah. So
Huh.
that's why some people in the know now have those desks that go up and down and they stand half an hour every hour. Some people put on a alarm and every 10 minutes they get up and walk around. I'm a bad one for that. I get deep into thought and creating a PowerPoint or doing a newsletter or something, and I can sit for 2 or 3 hours. But that isn't good. I know it. And this brings us to movement. And we use movement on purpose rather than exercise. Because movement can be different things for different people. We all have different abilities to move. The important thing is to move. It's a crucial part of self-care for anyone with a chronic illness or autoimmune condition. Has short-term and long-term health benefits. And the kind of exercise is dependent on your health, and it may fluctuate over time. You can work with a healthcare professional to determine the best movement plan, or some physiotherapists are really good at helping people, or exercise therapists, but I know not everyone has access to someone like that. So often it's a trial, like, is it yoga? Is it chair yoga? Is it Tai Chi? Is it just walking in nature? And while I mentioned nature, they've also shown health benefits to that, such as getting out in nature, or as the Japanese call it, forest bathing. And we have a fantastic taping of a seminar we had presented to us on forest bathing. That's up on our website. You might want to have a look at. It's not strenuous. The fellow that leads it, he can spend 20 minutes looking around a tree trunk and taking in what is there for him to observe. But it's movement, it's out in nature. Yeah, so movement could include walking, running, swimming, water sports or aquafit, being in the gym, yoga, Pilates. You could tone that down too, Tai Chi. Really move, and move everything you can move, meaning your shoulders, your elbows, your wrists, your ankles, your toes. Yeah. The benefits of movement: improved range of movement and energy, reduced pain and inflammation, And actually, that can seem a contraindication, but there is research now that shows movement helps chronic pain, even though it's not something you might want to do. Of course, you don't overdo it, but you have to do something. Leads to better overall health and risk of developing other conditions. It improves your immune function as well. It improves mood. They've shown that it's as good for depression as some of the antidepressants are. And less risk of side effects too, and lots of other benefits, including better sleep. All right, and last but not least, it's a pillar we've called mind and body, and that's to incorporate the effect our mind has on our body and our body has on our mind. They're actually not separate. Our mind is made up of physical substance, part of the body. And I don't know how many of you know this, but serotonin is one of the neurotransmitters that's very important in depression. And it's a neurotransmitter in our nervous system, particularly the brain. Most of it is actually made in our gut. And then it is transported up one of the big nerves in our body called the vagus nerve to the brain. So there's another connection between our gut health and our mood. And that's quite recent understanding by the scientists. Anyway, so mind body, it incorporates work in the other pillars. In addition, it can involve other activities to help our stress load, our psychological health, our sense of community, and more. And you've probably read about people who live in the blue zones in our world. And those are people who those are areas of the world where they have a large percentage of people, higher than normal percentage of people, who are living into their hundreds and are well. And they've analyzed them. What is it? Is it that they don't drink, they don't smoke, they exercise every day, they only eat lettuce leaves? What is it? And you know what they found it is? It's the sense of community and the feeling they have a role in community still. So there's another link between mind and body. So this is another area that's really important to consider when you're managing a chronic health condition. And these can be activities like promoting relaxation, reducing stress, such as meditation, deep breathing, or yoga. In our weekly meetings, I try, and I probably should do this more often, but once a quarter we have a session on learning meditation and relaxing and breathing together. Just to underline the importance of that. Taking care of our mental health is important, might include therapy. The support groups such as you have are really important. Peer support is really important. Being understood is important. I think I read recently Pico Iyer. I think he's the interpreter for the Dalai Lama. He said that one of the most disastrous things in life is not being understood. So the peer support group's really important. Participating in activities that we enjoy, spending time in nature, building relationships and community with like-minded people. And here's one that's tough for lots of us. Putting up boundaries and saying no, and learning to say no. And it's a skill set, to say it in a nice way, not a hurtful way, but protecting oneself. So the benefits, they're many: reducing stress, improved mood, better sleep, enhanced physical function, and improved overall health of mind and body. So before we get into the next phase of self-assessment, are there any comments or questions or things you'd like to share with each other about those?
Well, I think personally, I think they're brilliant. I mean, we know that we need to look at every aspect of ourselves to make sure that we're whole. And I think you have hit it on the head. It covers everything. So I know we try and get speakers for each one of those pillars all the time through the year to help people.
That's what I do too.
Yeah.
Yeah, and one of my first speakers I thought was really interesting. I learned a lot, but I didn't realize that by having chronic inflammation, we were all twice as much at risk for having a cardiovascular event.
Mm.
Yeah, and that kind of started me on finding speakers for all the pillars. You're absolutely right. Yeah.
Yeah. Yeah.
Yeah. All right. So now we're going to do some work, self-reflection. You don't have to share this with anyone unless something crops up that you want to share. So the first thing is, what activities are you actively doing for each of the pillars? And I'll just give you a few moments to think that through and fill those in. Louise, give me maybe people can do a thumbs up or put their pen down when they're ready, and you can let me know.
Well, there's a couple of thumbs up, maybe. Oh, yep. I think all the ones I can see have all got thumbs up. So it looks like we're doing well.
Okay. So now I want you to be honest with yourself, and out of 10, how would you rate your performance or focus on each pillar? And I'll give you a few minutes to do that.
Yep, we've got a few thumbs up already for that one. Yep.
Okay.
Looks good.
Now, I want you to think about where you'd like to be, and it's not necessarily to get 10 out of 10 for each pillar, but where would you like to be?
How are we going? Thumbs up there? Yep, lots of
good?
thumbs up there. Yep.
Okay. All right, now, of course, what we're going to do is compare the scores. What's the difference? So the future score minus the now score. Now, as I was saying, we do this every year because we realize you can't hit everything at once. You know, you just can't. Life's busy. So we do this to try to focus ourselves on what we want to, where we want to put our attention. All right.
Yep.
All right. Now, looking at that, what actions would you like to take to close the gap?
Got some thumbs up there.
Okay.
Yep, all good.
And what support will you need? This is an important piece. Because if you live in a family setting or a setting with somebody, when we make changes, it does affect everyone else within that system. So what support will you need? And sometimes that's like you need a buddy to walk with, so it keeps you accountable, and it might be for safety. Just one example. You might need someone to turn off the television if you're trying to go to bed earlier and it's noisy.
How are we going? Thumbs up with that? Yep, lots of thumbs. We're all good.
All right, so now you probably have figured out which is the most important pillar and action for you to focus on. And I think this is also an important question. What are you going to do to create space to be able to do this action? If you've decided you're going to take up swimming, or go to aquafit, or go for a walk, how are you going to create time to do that? If you're going to cook from scratch, maybe a couple of times a week, if that's a change for you, how are you going to create space to do that? And finally, can you think of any potential roadblocks that will get in the way? And of course, the question is, how will you deal with that? And finally, what boundaries can you put in place to support you? Or what help can you put in place to support you? It can be as simple as speaking to your partner about what you feel you need to do over the next year and ask for their help. It might be finding a ride. If you can't drive, don't have a car to get you where you'd like to go. And finally, just a few resources. Know your numbers and trends. As I mentioned this earlier, it's a list, and there might be tests or things that you and your health provider have consider are important that aren't on the list. It's easy to add it to the list, and then it helps you keep track. We have lots of videos on our website on all of the pillars, and they're all free. We have a Facebook group you can join that we share most up-to-date information as we come across it. And of course, Dragon Talks. There's a Monday evening group in Australia and there's a Wednesday at 10 in the morning group. And people come and go depending on the topic and their interest and their ability to attend. It's not a fixed, you don't have to turn up every week. And again, there's no cost. Yeah. Just let us know you'd like to join, and that's it. So, reflections and time to share. And I'll stop sharing now so I can see you. I hope you found that helpful, and I'm quite happy to have any discussions. Yeah. Stop presenting. Oh, there we go. Now I can see you. It's great.
I'm just going to stop recording so that the people, if they want to share, it won't be recorded anymore. Okay.
Nice. Very good.